Cases of RSV are on the rise, and the CDC says it can cause mild cold-like symptoms for most, but it can also harm or kill children. A new drug to fight it is now in short supply. ABC's Rena Roy explains.
Health experts say that respiratory illnesses such as RSV have already taken hold in southern states and will likely spread north. In Texas, health officials say cases of RSV are overwhelming emergency rooms.
When we arrived at the Texas Children's emergency room, it was overflowing.
In Fort Worth, Texas, officials at Cook Children's Medical Center say they treated 240 RSV cases over the last week alone.
That's a patient checking in about every 3 minutes.
Tiffany and Trice Adams had their preemies diagnosed with RSV a week apart and had to have them treated at different hospitals at first because of capacity issues.
I felt helpless the whole time. We were just kind of at the mercy of the hospitals. And, we were an hour apart.
As RSV season starts, there are 2 new tools to protect babies from RSV. One new shot, nirsevimab, meant to protect babies against RSV, was approved earlier this year, but supply has been limited. The CDC released a health alert in October with new recommendations to ensure the most vulnerable children would be prioritized.
This is concerning because while we're seeing the rise in RSV, we're limiting the ability for those kids that are vulnerable to RSV to get the protection they need.
Those concerns heightened as doctors say the so-called triple-demic season of RSV, COVID-19, and the flu is fast approaching. The drug's manufacturer tells ABC News the supply constraints were due to an unprecedented demand that outstripped their estimates. A federal health official also says progress is being made and that tens of thousands of doses of the shot could be available as early as next week to help alleviate shortages. There's also a new maternal RSV vaccine given later in pregnancy that can protect babies at birth from RSV, and that supply is not limited. Rena Roy, ABC News, New York.